The next subject to how to manage the clinic visit, like how to create visit and how to manage the patient. So we have logged in. So always we start with the clinic tab. On top there are many tabs. So in the wards, I think we used to click on wards and then continue. So for the clinic we put clinic. As we have logged in as ward 1 clinics, it is the ward 1 clinic is selected automatically, and the list here shows that the appointments given today. So we have given some test appointments. Another, like the minor staff will or other staff will create the appointments for you. So these are the patients, for example, for today's clinics. So there will be red numbers and blue numbers. Red means first time usually, and blue means the second visits. So you can even filter like how many blues are there and how many reds are there. You can filter through this bar. So all means everything is displayed. So here another thing I wanted to highlight is this status. Status means the patient pending. Pending means now still not seen. Patient is in the queue. I mean, in appointment is given but not seen yet. You can select now here. There's a status called served. So we'll be coming to that. Now if we start seeing the patient, his status or her status will change to served. So what happens is when we start seeing the patient, this list will reduce. The pending list will become slowly reducing for nothing, and the served list will grow. Now we haven't seen anyone yet, so the served patients are nil at the moment. So we just will put all again to start again. And also just additional point is, now this is for today's visit for this clinic, right? So you can even see like say another day, next day how many tokens are given, how many appointments are given, or in a previous history how many we have seen, like the served ones. Like that you can just go through that. But we are interested for today's clinic, how many are there. So there are these patients are there. So then how the patient will come with a small sheet with the appointment number, either blue or red. So what easiest thing to do is, so suppose the number is 8, right? Or that we just start from 1. So the first number patient has come. So we just type it, and there's a red number, right? So suppose we say 2, then there's a blue and a red. So depending on the person who is seeing the red and the blue, it will go. So we just see the name and we just say, okay, we are seeing blue number 2. We just click on that. So I just enlarge this. I think it's better now. So when you click on the patient, there's a page will become like this, kind of overview, clinic overview. This. So we have to create clinic. Always is like this. We are create clinic visit means we are starting to see the patient, clinic patient. So we click on that, and then another page loads like it. Here you can put the weight. Now these things are not compulsory. You can just save it here, the save button, right? Or like there are some useful things, like if you feel it, like for example I put weight 13 just kilograms, like, and for the complaint also, now you can just leave it blank and go. There's another small advantage that if you fill it once, every time you create a visit in the future, this will auto load. So I just put say so you can say there are some predefined lists you can select from. Otherwise you can type your own thing also, like investigator for something like that. And you can put visit note if needed. Maybe the time constraint. So we start creating the visit and save it. So save means now we have started seeing the patient. Now this is the main screen that we are doing all the other things. Like on the left side you can see there are a lot of commands, but no need to concentrate on all things. We are today, we're just focusing on lab ordering, PACS system, PACS is X-ray ordering, and the prescription. Right? So this is the overview page of, now you can see in this patient overview, and under that this visit information, the complete we have put has come and the weight has come here. So additionally I just tell now itself, now if you want to change anything, you can, there's edit button here, not the first one, the second one here. So you can even change the complaint or the weight and everything and save it. Otherwise you just cancel and go back. Just edit. So you can view all that. So here, so that's how we kind of create a visit and navigate through that. So I'll talk about this ordering and PACS and X-ray later. Right? So from here, suppose there are a few additional things I'm going to say now. So now we have started seeing the patient. Now if we want, suppose we finish seeing the patient and we want to see the next patient, we always start with the clinic tab. Just remember that. Right? And now you can see, now we put number 2, we saw the number 2. That number 2 has gone from the list. Patient was blue, right? So that patient has come to the served list. I just want to demonstrate that. So if you have to go again, say suppose patient has seen and you want to discuss with the consultant, come back again and edit some other thing. So then you can check through this. Right? Just remember to check through the served patients, and then when you click on that, that same overview page will come. So no need to create a visit again. Already this clinic visit is created for your name. Right? So you just click on that and can go back to the same page that was there and do whatever the things you want to do. And another thing, easy point is that if you go to this home tab, if you again forget it, doesn't matter. Like this home tab, it shows all the patients you have seen today in the clinic. So that's also another shortcut to see like the patients that you have seen. Now there's additional patient because I was testing earlier, right? So that page also goes to the same page, right? This one. Yeah, same page. So you can continue whatever you're doing. So that kind of basic way how to navigate the create and see the patient. Go to another patient and we start again. So we create a clinic visit. Here you can, like if you start typing, there will be a like ICPC list complaint which will come. If you want, you can select from that, otherwise you can type in and just save it. Now we have to tell additionally here. Now we used from the left side pane for the new prescription and the lab orders and the packs. The same. Now when you create the visit, there are kind of a lot of other blue color buttons down. We used to save it and go. Now these are the same shortcuts for the same commands on the left side after you create the visit. For example, now directly if you want to go to the prescription from the create visit page, you just without saving, you just press prescription. It will save automatically. So just it will save and directly go to the prescription page. Just a shortcut, small one. Right? So the visit is created, but directly we have come to this page. Now in this patient,